Our mission really is to bring transportation and health researchers together to do research around transportation emissions and health. So it was a really good fit for my transition. When we thought about health in transportation, we mainly thought about motor vehicle crashes or accidents. Globally, 1.5 million deaths around the world are because of motor vehicle crashes. Many of these deaths are happening in low and middle income countries, and many of them are happening to vulnerable road users, so not car drivers, but more like pedestrians, cyclists, and people on motorcycles. In some of the health impact and burden of disease assessment that we've done for cities, we see that the air pollution and physical activity results or impacts are much higher than motor vehicle crashes. And when we do this meta-analysis and look at all these participants together, there's a 7% increase in the chance of dying prematurely compared to your life expectancy that you should have otherwise with the exposure to PM2.5. And the exposure interval we're talking about here is quite small. It's 5 micrograms per meter cubic. So with every 5 micrograms per meter cubic increase, your risk of dying prematurely is 7% higher. What's the risk of a child getting new asthma if they're exposed to traffic-related air pollution? And what we saw in this analysis, and this data set is over 1 million kids, so it's a really strong data set, I think. We saw a 5% increase in the risk of getting new asthma with the increase of NO2 by 4 micrograms per meter cubic. Based on the knowledge that we know that links transportation to health, why is it not making its place into planning and policy? Many reasons, of course, but some of the reasons that I want to highlight was the lack of awareness of health impacts by some of the transportation professionals, the lack of awareness by the public, but also an important one was the lack of tools to quantify and cost these impacts. So you can actually perhaps take them into account in transportation investment appraisal. The way we do transportation investment appraisal actually doesn't have a mechanism to take these health impacts into account. And I wonder if you actually can quantify them and cost them. Is there a way to push it into this transportation investment appraisal, into this cost-benefit analysis? What are going to be the problems? Is it going to be that we think there's a lot of uncertainty in these impacts? Are we doing the right research? Are the studies that I showed, are they impactful? Can they be impactful? Can we do something differently to make them more impactful? How can we contribute more to a more evidence-based approach? Is the costing, is the quantification, the numbers, can these be game changers when you talk to policymakers or to developers or not? If not, what can we do?